Good evening. Thank you for joining us. Good evening. Thank you for joining us for Mary Washington Healthcare's monthly recruitment conversation on Facebook Live. My name is Darla Burton, and I'm the Director of Recruitment, and I will be your voice this evening. Tonight, we want to focus our conversation on our new grad residency program that Mary Washington Healthcare is so proud to host twice annually. The highly competitive program is facilitated by Dr. Jane Bowles, Mary Jane Bowles, who has been with our organization. I'm so sorry. Let's start over. Tonight we will focus our conversation on our new grad residency at Mary Washington Healthcare. By Dr. Jane Bowles, Mary Jane Bowles, who has been with our organization. What is that? Turn. All right. So, Mary Jane began her career here at Mary Washington Healthcare over 20 years ago, and in our ICU supporting the Open Heart program. Under Mary Jane's leadership, this program boasts an 88% retention rate of our nurses that have completed the program. These nurses continue to grow within our organization. For example, these two professional nurses that are joining Mary Jane in our conversation this evening. Joining Mary Jane is first Amber Fortune. Amber joined our residency program immediately following her graduation from Germanna Community College in 2014. She will graduate in 3 days from University of Mary Washington with her bachelor's in nursing. Also joining Amber and MJ is Krystal Brunton. Krystal joined our residency program in 2016 after completing her associate's degree at ECPI. She will complete her bachelor's degree at the University of Mary Washington this May. Please keep in mind this Facebook Live event is a career conversation. Please submit your questions that you may have throughout this program because we want to respond to all of them live while we're on the air. However, if we're unable to do so, we will respond via Facebook later. And without further ado, Mary Jane.
Good evening. I'm Mary Jane Bowles. I'm the Clinical Nurse Specialist in Critical Care Services here at Mary Washington Hospital. And I'm also the facilitator for the new grad residency program. And so happy to have with me tonight Krystal and Amber.
Thanks for joining. My name is Amber Fortune. I work at Mary Washington Hospital on 4 North, which is oncology palliative. I started through the new grad residency program and I graduated that in March 2016.
Hi, I'm Krystal Brunton, and I work on the 2 West unit at Stafford Hospital, which is cardiac. And I joined the new grad residency program in March of 2016 and then graduated in 2017.
So first we're going to go over a little bit of the tenets of the new grad residency program. We started the program back in 2013 with our first discussions with how do we bridge the gap between nursing school and the real life world workforce. And knowing that there is not a nursing program out there that can offer clinical skills on everything that is needed to be a bedside nurse. So meeting the intent of the 2010 Future of Nursing, we wanted to build a really strong, credible nursing residency program to help bridge that gap. Initially, the nurses apply for the program. They go through an initial screening interview, and that is their first introduction into the program. At that point in time, they're not assigned to a unit, they're not assigned to a department, they're just assigned to the program itself. Typically that starts with the hospital orientation and nursing orientation, and then given our EMR, they go through extensive computer curriculum training. The next 6 weeks is rotations through several different units. And with that rotation are didactic classes that they also attend. And it's topics that are very relevant to our patient population here at Mary Washington Hospital and at Stafford Hospital. So we cover the neural system. We are a stroke center, so we take the NIH stroke scale. We talk about respiratory, and we delve into interpretation of ABGs and manipulation of chest tubes and care of the patient with the chest tube. We talk about the care of the surgical patient because we have a large surgical population here and our protocols. We talk about fluid and electrolytes because that covers every patient population and how you handle intra and extravascular space. And then, of course, we do a very in-depth telemetry class because as part of the requirements of the program is taking that dreaded telemetry test. After the 3 rotations, for lack of a better term, we call it going through the second interview. But this is really a discussion between the managers and the new grad resident of when they were going through the residency, what unit did they find would be the best fit for them? And then that offer is made, and so there is another HR offer to the new grad resident, and then they start their orientation on what we call their home unit, or the unit that they're going to complete their residency orientation on. After orientation is completed, they're not done with me yet. They're stuck with me for an entire 1 year because we meet every month in monthly classes. And these monthly classes are a variety of topics, from clinical topics to case studies to ACLS algorithms, since several of the nurses will be working on units where they have to obtain their ACLS. So it's really a variety of clinical topics. We also have a professional practice model here at Mary Washington Healthcare, and our professional practice model is called the ACE model, or Advancing Clinical Excellence. And there's requirements in the professional practice model for each level of nursing. And so we build in those professional requirements as well as the clinical topics so that when the new grad resident completes their first year, they literally have met the requirements for level 1 and they're ready to move on to level 2. And then, of course, we party because it's very important to, after you complete something, to have a celebration. Although I'm the facilitator of this program, I most certainly could not do this program. Clinical educators that support me in teaching the classes, and they're the ones that are out helping to round on the new grad residents. They have check-ins with them on the floor. They make sure they're doing okay. They make sure the schedule is working out okay. They are just in a myriad of ways are very integral to this program. So I've given you a little bit of the tenets of the program, and now I'm going to turn it over to Krystal and Amber because I want you to hear about the program from their perspective.
I'll go first. So when I first applied to the program, I was nervous, of course, coming out of school and not knowing what to expect and wanting to gain all the knowledge I could and experience. And the new grad residency program has been one of the best experiences for me as a new nurse coming into an acute care setting because you have a good sense of support from all the other nurses in the program, and Mary Jane is there and she's so amazing, and all the educators do such a good job helping you feel comfortable with interventions, how to behave at the bedside and how to care for your patients. And I miss my monthly new grad classes that we had, all the education and just the being able to go there and vent about, a doctor that was giving you a hard time or a patient that was difficult to deal with. And it's just been a really good experience, and it's helped me become a strong, confident nurse and giving me great skills at the bedside.
I agree with all of that. I also enjoyed that we got to do go to the different units, and I always thought that I wanted to be a surgical nurse coming out of school, because that's where I had a lot of my clinical experience in nursing school. And so being able to I chose the medical surgical aspect of the program. So I got to do 2 medical units and a surgical unit, and I really found my home when I was in a new grad residency program. And I love oncology, and it's really been able to connect with the people that I was able to meet through that. And having the support of all the other new grads, because as a new grad, you don't know what to expect, and you don't always know who else is new. So it's nice to have experienced nurses, but it's also nice to have somebody who knows what you're going through when you're first starting out.
Yeah, and I agree. I thought, when I first started, I wanted to do critical care, and being able to float on the different units and really get hands-on experience with the different types of patient populations and what they require really helps you decide what unit's going to be best for you, what's going to, be your happy place. And so that was nice.
Yes, definitely.
Both Krystal and Amber alluded to the monthly classes, and the monthly classes we add a lot of variety of clinical topics, but typically how we start the class is, what have you seen? What's happening? What's going on out there? What are the rumors?
How can we fix it?
How can we fix it? But that has become such an important part of those monthly classes, because it's there that it's a safe zone. We call the classroom Vegas. What happens there stays there. It's the safe zone that they can very freely bounce ideas off of each other. And, well, how would you handle this? How would you handle this? And sometimes I'm just very quiet, and I allow the class to talk, and then kind of say, well, let's think about it this way. But it's a great way for you guys to out loud talk about ideas and how to handle situations. And so I think that is part of the most meaningful part of those monthly classes.
So we do have several questions that have come in. One of the questions is for our alumna, and that would be, what have you found to be the best part of the residency program?
I would say the best part for me was definitely having, the educational review and the monthly classes to focus on different systems within the body, because I know in nursing school you go to clinicals, but you don't really get as much hands-on experience as you want. And when coming out of nursing school, you really want to feel like you've got all your tools in the bag and you're ready to go out there. But in reality, you don't. So these classes and the ability to go out on the floor and learn, for instance, ACLS protocol or wound care information, just the things that you need hands-on experience with, has been really good.
I agree. Also the friendships that you form, because in nursing, it's a special career, and you have to have people that you can rely on and really talk to and feel like they understand you and you understand them.
Yeah.
Excellent. Mary Jane, we'll put this one towards you. What can enhance a graduate nurse's resume to be selected for this program, and are there GPA requirements?
What enhances the resume is if you have some prior CNA experience. It helps. Having a positive attitude and caring about patient care, and exuding that positive attitude as you come in to do your interview. And having a purpose, having a 5-year plan of what you want to do, where you want to go, where you want to end up. And we do not have a formal GPA requirement. However, we do look at GPA and the transcript as we're looking through applicants.
And how long do you spend on each unit as you're rotating?
Each unit is 2 weeks, and within that 2-week time frame is 4 12-hour classes and then 2 days of classroom time.
Excellent. Of course, I have another question for our new grad alumna, and that is, Justin says he starts a new grad program in March. Do you two have any advice for someone about to get started?
I would say just have a positive outlook and be prepared to retain a lot of knowledge, and it's just an exciting time. You want to get out there and get started, and I think to just have a positive outlook and just show up and be ready.
Be ready for anything.
Yeah.
We have a good time.
Oh, yeah.
You have to have a sense of humor to be a nurse.
So, Mary Jane, what is your proudest moment or proudest result of this new grad residency program?
What makes me most proud is watching the nurses grow. I mean, from when they come in to at the end of their residency program, they do a teach back presentation. So it is, they pick a topic of their choosing, a topic that they don't feel comfortable with, and it's part of teaching them. Now you are graduating from your first year of nursing, and you have lots of experiences that you can share with new staff, and it's a way to get them to be able to teach and to present to new nurses coming in. So that's one thing. The other thing is watching these nurses that have come in that have been tenuous, have been very quiet, maybe only said 2 words the first 6 months that they've been here, and now they're managers of units, they're educators, they've gone back to get degrees, they're nurse practitioners, they're certified nurse anesthesia. So it's just amazing to realize that you have one little eensy part of that, but it's just amazing, and it just makes me so proud to watch them grow.
From your perspective, Amber and Krystal, how are the new grad residents welcomed on the units?
I think we were welcomed with open arms. Mm-hmm. I think everybody's always excited to have somebody new there, ready to learn, and extra hands are always helpful.
Yeah, I agree. I mean, you always, I guess, feel nervous, and you always hear, the rumors of the veteran nurses going to give you a hard time. But really, I feel like everyone's been very accepting with open arms, and they've realized that we're going to be a part of the team. So there's a sense of welcome, and I thought it was a good experience.
Yeah, and now that I've been here for a few years, when we get new grad residents on our floor, I get excited. So I'm like, I was just there.
Yeah, and you want to show them, like, it's okay, don't be scared, don't be nervous, like, we're here for you, ask any questions.
Yeah, definitely.
Did you all attend UMW, some of the classes together? Were you able to connect as you continued your education journey?
We did. Actually, we weren't in the same new grad residency, but we did have a class at UMW, so that's actually how we met, I think.
Yeah, we met. It was the very first class for the BSN program at University of Mary Washington. We happened to have a class together, and we've kept in touch, so it's been nice to have someone that is, working at the same organization and also going through the same school program with you online, to have that support.
And they have a really tough professor.
No, it's been I just finished up a class actually the other day with MJ. It was an evidence-based research class, and she's been a great professor.
I have one more assignment for you.
So how many new grad applicants are accepted for each residency program, Mary Jane?
Darla, you're probably better at answering that than I am. I know that we usually take around 50 applicants and then we accept 30. But I know sometimes we've taken more applicants than that.
Yeah, we really are open based on the number of candidates that we receive and, the interview process, and sometimes we have a number that we're looking at recruiting, and then we have more outstanding candidates that we just don't want to turn away anyone. And Mary Jane says the more the merrier. So, so I think that's a pretty fluid number. Mm-hmm. Is the upcoming residency event only for those graduating next semester? And maybe you want to talk about that because we haven't talked about that yet.
We have an event next week, December the 19th, from 5:30 to 7:30. And it is information on the RN residency program. And when we first were brainstorming about this event, we were targeting RNs as they were graduating, either the May graduating RNs or even RNs a year from now that are graduating, trying to help them plan on what they wanted to do after graduation. However, we've gotten several phone calls of individuals that are not quite sure if nursing is the career for them. And so they are wondering about coming to the event. And I'm like, yeah, come on. We'll be talking about the RN residency program, but we will also have individuals there talking about if they want to join, how do they become a certified nursing assistant. So there'll be other potentials there. So come, learn, ask questions, and it may help you make up your mind what a great profession nursing is.
Does MWHC offer to support RNs interested in going back to school?
Well, I think probably Amber and Krystal are better at answering that than, because they're going through it. So
yeah, there's actually a couple different options for employees to go back to school. So there's tuition reimbursement, and for full-time, they offer a set amount for full-time employees and a set amount for part-time employees. And then also there's a scholarship program which covers the entirety of University of Mary Washington's, basically the cost for the whole BSN program. So there's a couple different ways that you can get some assistance with your schooling, which is really nice.
I did the tuition reimbursement throughout the whole time I've been going to UMW, and it's just by semester you apply to the tuition reimbursement, and then they accept you or decline you, which as long as you're meeting your GPA requirements, they're going to accept you. And then you get your reimbursement. So it's been very helpful.
Yeah, anything helps.
Yes.
and then what is the difference between tuition reimbursement and the scholarship program?
So tuition reimbursement is, at least for full-time employees, I know they allot you $3,000 for the year. And the scholarship program, I believe it's around $15,000, but you also, after you graduate, you sign a contract to stay with the organization for additional years after that. So there's a couple different options for you.
Yeah.
And then there's also the requirement of when you're coming on as a new grad of the commitment of, if you're going through this program, the commitment to the organization for 2 years.
Right.
And I didn't say that up front, but there is a contract that you sign for the commitment to 2 years of going through the program.
But if I remember correctly, is it if you just stay on your unit for an X amount of time? Is it 6 months? And then you can go anywhere within the healthcare organization.
That would be
so
correct.
you're not strapped down to the same unit or the same place for 2 years.
Yeah, so if you end up on, let's say, cardiac and you don't like cardiac, 6 months later you could go to oncology or surgical, mother, baby, whatever suits your needs.
It's the commitment to the organization.
Michelle Kessler just posted, and she said, as a 6-year veteran of the new grad residency program, I can attest that it was the most meaningful experience I have ever had. So thank you for that input. Also, someone asked about applications for the next graduating class in May, and we are accepting applications at this time. You can apply at MWHCcareers.com and look for the RN New Grad Residency. If you submit your application prior to December 18th, then we will be conducting on-site interviews at our event on the 19th. So we're hoping to make early offers. So while you're home for Christmas break, you can also go back to school knowing that you have a position upon graduation. So I thought I'd share that too.
And for more information on the event next week, you can go to MWHCRNResidency.com. And again, that's December the 19th from 5:30 to 7:30. And it's on our hospital campus here. It's in the Moss-Free Clinic building, in the FIC building that is the conference center in that building.
Excellent. Well, thank you all for joining us. Thank you to our speakers and our students. Continue the conversation on our Facebook Live page, and a member of our recruitment team will respond to you tomorrow. I can't thank you enough, Amber and Krystal, for sharing your experience and sharing Mary Jane with us, because she enjoys being with her students. Sometimes tearing her away for stuff like this is difficult. So we're thankful. We do thank you for joining us tonight, and hope you'll plan to join us at our next Facebook Live event, which is on January the 9th. Details will be posted on both our Mary Washington Healthcare and MWHC Recruitment Facebook pages. Don't forget, all nursing students are invited to attend our RN Residency Open House on December 19th from 5:30 to 7:30 at the John F. Fick Center. Log on to MWHCRNResidency.com. And most of all, have a happy holiday season, and we look forward to continuing our conversation next year. Have a good night.